Good day everyone, we are Group 2 and for our video, we will be demonstrating how to administer basic first aid. First aid is care given to a sick or injured individual who is thought to be in a life-threatening situation in an effort to stop their death or additional health harm. For someone who has lost consciousness, assess the situation, and before starting basic life support, ask them if they're okay, and gently shake the shoulders or legs. If they do not respond, their airway is blocked, lay them on their back, place one hand on the forehead and two fingers from your other hand to gently tilt the head backward and raise their chin in order to free their airways. Place your ear next to their mouth for around 10 seconds and try to hear and feel their breathing. Watch their chest to see if you can see any breathing movements. If the individual is breathing and laying on their back, and you do not suspect any spinal injury, gradually move them on their side towards you. Bend the upper leg so that the hip and knee are at a 90-degree angle. If the person's breathing or pulse stops at any point, flip them on their back and commence CPR or cardiopulmonary resuscitation. Position your hand on the center of the chest and place your other hand on top. With your arms straight, lean over and compress the chest 2 inches in depth for 30 times. After 30 compressions, begin mouth to mouth by tilting the head back, lifting the chin, pinch the nose and place your mouth over theirs and give 2 full breaths. Repeat 30 compressions and 2 breaths and continue CPR until you see signs of life. Alert people in the vicinity and call for help and medical services. Always remember the action plan. D is for danger, R for response, A for airway, B for breathing, and C for circulation. For our next demonstration, you will witness how to apply first aid to someone who is bleeding. For step 1, stop the bleeding. Apply direct pressure to the cut with clean cloth, tissue, or gauze until the bleeding stops. If the bleeding do not stop and continue to soak the material, do not remove it and apply more cloth. Do not forget to wash your hands before cleaning and after dressing the wound. For step 2, clean the cut or wound using warm water. Do not use hydrogen peroxide or iodine, which can cause damage to tissue. Roll the bandage firmly in place, and if the casualty becomes unconscious, follow the DRABC. Remember, do not perform first aid if you are unsure that you can perform it appropriately.